So I've had some thoughts about how to ensure that you keep as mentally well as possible. Whenever somebody asks you how you feel, your automatic reaction is, I'm fine. But really, you need to talk to people and tell people if you're not fine. And in many instances, it's not just confined to looking after your stoma or the effect that having a stoma. It could well have been that that has actually made an improvement to your quality of life. But having major surgery is a difficult thing, and it does take time to recover. So I really encourage you to talk to others, be honest, share your feelings, keep active. I know it sounds that like the last thing that you want to do, but the worst thing that you can do for your mental health is to keep yourself at home and not push yourself to go out for a walk. Now, you're not expected to be able to go out and walk miles or run marathons. If that's what you can do, fantastic, and that's so good for your mental health to be able to get back to what you normally do. But if an achievement for you is getting out and walking down to the shop or going to visit a friend, that's really important, and that will help to keep your mood up and also prevent you from spiraling down into any further despair. There's a big relationship between your diet and your mental health as well. So it's important to eat well. Make sure that you have a good, nutritious diet and that you eat what you like, when you like. Whenever you're in hospital, your diet can be really confined, and maybe even after having an ileostomy, for the first 6 to 8 weeks, your diet is a little bit restricted. But then try and get back to what you enjoy eating, and just keep in mind of the good nutritional benefits of a really nice, nutritionally varied diet, and that will really help with your mental health as well. Hydration is another important thing. Make sure that you're drinking well. Make sure that you have a good glass of water every hour. 6 to 8 glasses within 12 hours is what they recommend. And if you enjoy going out for a drink and going out socialising, don't cut yourself off. Use all the opportunities that you have to go out and meet people. And if that is going into, going to a restaurant or going to a pub, you don't have to drink alcohol. Just make sure that you're drinking. It's really, really important. Also acknowledge your limitations. Don't push yourself if you don't feel that you're able to do something. If your body's telling you that you're tired, you need to rest. But if it is your mind that's telling you that you can't go out because you have this bag, or that somebody will notice that you have it, the likelihood is not one person will even know that you have had surgery and that you have a stoma bag attached to your tummy. So don't let your mind be the barrier. Certainly if it's a physical thing that's not allowing you to venture out, but don't let your mind be the barrier to you going out and improving your mental health. There's lots of support groups, either online or one-to-one, especially, specifically stoma related. There's ileostomy, colostomy, urostomy, stoma support groups. There's lots of forums, but just be wary of adhering too much to what other people say if it's not clinically evidence-based, because what might work for one person might be detrimental for somebody else. So just be wary of taking on lots of advice from people who aren't professionals. You do have your team of professionals then as well within the hospital. So you do have your stomach care nurse. Part of her role is really to support you in the recovery, and that does include your mental health recovery as well. I would have had patients who would have come back frequently who didn't particularly have any physical problem wrong. They just needed to talk about how they were adapting their life to living with a stoma, and also just venting what their feelings were to somebody that wasn't their family member, that they were able to get out their thoughts and feelings without any judgment at all. And that's what your stomach care nurse will do for you too. If you have a good relationship with your GP, that GP will be there to listen to your problems as well, because your mental health is as important as your physical recovery from this surgery. Your family and friends are a good support network, but sometimes they can be really too close, and you might feel that you can't tell them all your inner feelings. But they are there to support you, and they will want to help you if you are open and honest with them. And you'll be surprised at how strong people will be for you if you're open with them, because they'll want to help, and they can't help unless they understand exactly what you're thinking and feeling. Another little tip would be do something that you're good at. If you like crocheting, if you like painting, if you like writing blogs or stories, anything like that. If you are a runner and you want to try getting back into that, knowing that you can achieve what you did before your surgery will really promote your good mental health as well.